Hi, my name is Juliana Panhorst, and I'm a current fourth year undergraduate student in the Public Health College here at the University of Arizona. This summer, with the support of the Global Health Institute Scholars Program, I had the opportunity to travel to Potchefstroom, South Africa, to work with students and faculty at Northwest University in the Dietetics Department, completing a community nutrition internship. So just to provide you with a bit of insight and explain where this program is, to give you perspective on where this work was completed. So Potchefstroom is a small city in the northwest province of South Africa, and it's situated 2 hours outside of the largest city in the country, Johannesburg. I specifically worked in the areas surrounding Potchefstroom, including the township Ikaheng. So while this research wasn't completed on campus at Northwest University, all of the daily clinic activities were completed under the guidance of clinic staff and faculty supervision. Before I describe our work, it's important to share just a little bit about the state of nutrition where this work was completed so you can better understand the context surrounding it. So, in the specific district, which encompasses both Potchefstroom and Ikaheng, malnutrition remains a critical issue, with stunting, overweight, and obesity prevalence affecting considerable proportions of the children under 5 population. So, with this background, our aim was to establish a better understanding of the determinants of child malnutrition in Ikaheng, South Africa. And we did this through several different mediums. We took physical examinations of children to track their health against benchmarks, including data like weight to height, mid upper arm circumference, and head circumference. We also conducted one on one patient interviews with mothers to understand feeding practices and other relevant health behaviors conducted inside of the home. Additionally, we engaged in quantitative clinic level health statistic gathering and collected data by hand to understand the burden of several morbidities in the area. And it is just important to note that I don't have tangible outcomes to display here, as this work and data collection was performed as an essential component in certifying the dietetic students that I worked with to practice in community clinics throughout the country and to better serve and aid in this fight against malnutrition. Additionally, I worked with both my mentor in the dietetics department and another faculty member in the economics department to investigate food price trends in South Africa to better understand the relative accessibility of healthy items in regard to their health benefits over time. This allowed us to understand the determinants of malnutrition from another approach, which really aided in looking at the quantitative statistics and how this might factor into some of those other malnutrition qualities that we had noticed in those clinic. So through this work, I was able to better understand the factors contributing to malnutrition. I was able to tangibly understand that socioeconomic factors, including that of the food poverty line and food deserts, even those that exist within urban areas or cities, are leading contributors to malnutrition in South Africa. I've also been able to appreciate the importance of cultural and linguistic understanding when developing a health program. Initiatives that aim to accomplish or lend support to any community must first be accepting, understanding, and respectful in the way that they respond to health challenges. Working within the clinics has shown me the importance of clinic patient communication. It's critical to ask questions in the right way and in the right language, both in terms of respect and also in reference to language barriers, to obtain usable data and deliver effective care. Overall, this experience was an incredible opportunity and benefited me immensely both personally and professionally. I'm so grateful for this opportunity, and I want to thank the Global Health Institute for their support. Thank you so much for watching.